Welcome to the One Piece Implant Mentor podcast. I am your host and mentor, Dr. Andrea Joy Smith. The One Piece Implant Mentor podcast introduces our audience to doctors who are not only successful at placing these type of implants, but the audience will also meet the true pioneers who have led the way in one-piece dental implantology. Joining me tonight is one such pioneer, Dr. Todd Shatkin. He is a true innovator in this space, and his achievements are far too many to list. So we'll just get down to asking him some very interesting questions. Dr. Shatkin, welcome to the podcast.
Dr. Andrea Smith, this is just a pleasure and an honor to be here with you. You're just one of the most wonderful people I know, and I'm very grateful that you've invited me to join you tonight.
Thank you for so graciously accepting. Well, I'm going to start with a little background information. How long have you been practicing dentistry, and where'd you graduate from?
I graduated from the University of Pacific School of Dentistry in San Francisco in 1989, so that makes it 34 years.
Wow, that is quite a bit. And then tell me a little bit about your journey in dentistry. How did you start practicing when you first got out, and how did things go at that point?
I was fortunate to work with my father, who was both a dentist and a physician, DDS-MD, an oral maxillofacial surgeon, and plastic reconstructive and head and neck cancer surgeon. And I was so fortunate to work with him and my brother, who's also a medical doctor, plastic surgeon. For over 20 years, the three of us practiced together. Our father passed away, unfortunately, about 11 years ago, but we had a great experience working together.
That is amazing. So the plastic surgery office and the dental practice, did your dad work in a little bit of both?
He did. Even though he was a plastic surgeon, he never gave up his roots of dentistry, and he loved doing dental surgery and dental implantology. And so when I came into practice, we did all of the implant surgery together. We did everything from ridge augmentations and ridge splitting procedures, sinus augmentations, and onlay bone grafts, and iliac crest grafts from the hip, and rib grafts from the ribs, and all kinds of wild procedures that you never would have thought you'd ever do in dental school. But I got that experience to go to the OR with him and assist him and work with him on all these very elaborate surgeries. And so we did the conventional implants, of course, for the first 12 or 13 years of my practice, where we did the two-stage Brandemark style implants.
That's probably the most common one today. So then what was your motivation for developing all of the innovations in mini dental implantology?
When I first was exposed to mini dental implants in 1999 through a flyer that came in the mail from, at that time, Imtech Corporation out of Oklahoma, I looked at it and I showed it to my dad, and it said you could stabilize a lower denture in about an hour. And I said, "Dad, do you think this can actually work?" And he said, "There's only one way to find out. Let's buy the kit and give it a try." That same day that we got that flyer in the mail, we called up Imtech, we bought the system, and we started doing lower denture stabilizations almost immediately. I later found out that I was the first dentist in the country to buy the kit. They had sent out probably, I don't know, a few thousand of these flyers, and nobody else bought it on the first day they had them out there. Except my dad and I said, let's give it a try. So we started doing them right away. And it's changed my life, and it's changed the lives of thousands of my patients. It's been the most wonderful thing I could have ever imagined doing.
Where did your passion come from?
It's all about changing lives, like you said. It's changing patients' lives, and it's changing the dentist's lives. And that's where the passion is. The passion in your voice, the excitement of what you've done all these years. I know you've been doing small diameter implants for at least 15 years or so, and you're excited every time I see you at one of our courses or whether I talk to you on the phone, and you're not alone. There's thousands of dentists just like you that are so excited to offer these procedures to their patients, and that's what drives my excitement.
The things that you've developed and innovated made it really easy to practice. My experience with conventional implantology, it was just always so complicated. There's a million parts to it. Every system has its own driver and its own everything. And you have to have this big, huge tool chest of tools because you don't know who's going to walk in your door that needs a restoration on one that was done somewhere else.
I've got drawers full of parts. You have to have all the parts from all the different systems because, like you said, you don't know what part you're going to need next.
And patients, sometimes they don't understand that when they get that implant, that it still needs a restoration on top. They're thinking they have dental implants, but yet they don't have a tooth. The one-piece implant technology alone at least gives us an abutment to put some type of restoration on so that they leave with a tooth or a stable denture. So it's very innovative.
How many patients do you have that come in that have implants buried under the gum for years
There's a
because they
lot.
never got them restored because they didn't realize it was going to cost them more money to get the crown on it? They thought they paid for everything when they had the implant put in.
Let's talk about some of your innovations.
We started out doing lower denture stabilizations initially back in 1999, 2000, and then that evolved into doing upper denture stabilizations and cutting out the palate on the roof of the mouth on the denture so that they could open the palate and taste the hot and cold foods on the roof of their mouth, and they get rid of the gag reflex that the dentures would have.
What role did that play in starting your dental lab?
That was the acronym for First Laboratory, which was the first lab that we started. And then it evolved into Samuel Shatkin first and then Shatkin first after my father passed away. That's how we got started with the first technique, offering these procedures and these services to dentists all over the country.
How many restorations for mini dental implants would you say that your company has restored?
Over 700,000 restorations that we've fabricated for dentists around the world. We've sold well over 1 million implants.
Of those 1 million implants, how many have you personally placed?
So those 1 million implants don't include the ones I've done, but I've done over 40,000 myself in the last 23 years.
So you have actually changed a lot of lives in the last 23 years.
Yeah.
Now, before your dad passed away, did he get a chance to see the Shatkin First lab in its full bloom?
It was smaller when he was alive. He passed away in 2011. At that point in time, we were a much smaller company. But I'll tell you what he said to me on his deathbed. He said, "Your business is going to be bigger than you could ever imagine." He had a vision of what we were going to do. And back when he was alive and he helped us with the case planning, we did everything manually. He used to actually take a stone study model that would be sent by a dentist or an impression. We would pour it up in stone. He would drill the holes in the stone model, manually place the analogs for the implants in them. He would do that by looking at a panoramic x-ray and deciding where to put the implant and what angle to put them at. Then the lab would make the surgical guide on it and the crowns on it. It was all done manually, and they used to call him CAT Scan Sam before they even had such a thing as a cone beam CT scan. But he could visualize it with his brilliant mind in 3 dimensions, looking at a model and a 2-dimensional x-ray. He put it all together and planned the cases. And he said to me, "Todd, someday they're going to put my brain into a computer." And that's essentially what we've done with taking digital scans and 3-dimensional cone beams and merging it, and then being able to virtually plan the placement of the implants and then print 3D models to make the surgical guides on.
3D printers and CT scans, they're very common today.
Yes.
Did your dad have the benefit of working with the CT before he passed away?
We had the first iCat in our office when he was alive, but at that time they didn't have the ability to merge it with a 3D scan and print 3D models and all that stuff that we have today. But he visioned it. He knew it was going to come, and he was right on. It's been a wonderful journey.
As I've told you before, the main purpose of this podcast is to spread the word about mini dental implants to people who don't know anyone that's doing them. What advice would you give a dentist who is considering it or hearing it for the first time as it relates to starting this type of procedure in their office?
I kind of like to quote Gordon Christensen. He always says, "Just do it." I will tell you what the advice is. If you want to change a lot of your patients' lives and make them happy, whether it's stabilizing their loose dentures or replacing one tooth or multiple teeth, all of us have patients every day that have missing teeth and wear partial dentures that are uncomfortable or wear full dentures that they really dislike, or they can't tolerate the palate because it gags them. They have sores all over their mouth because the dentures move. In one short visit, we can solve that problem for them, and we're a hero. So you can become a hero in your practice to so many patients and change their lives. And in the process, you'll make a lot of money doing it.
I think the numbers are staggering. The number of edentulous patients versus the number of patients that are missing at least one tooth.
Yeah, there's 178 million Americans who are missing one or more teeth. And there's 40 million Americans who are completely edentulous. So there's so many patients out there to see you to have the work done. There's no worry about competing with the guy next door or the lady next door.
Exactly.
It doesn't matter how many dentists are on your street. There's so
Right.
many patients out there that need your services. All you have to do is get the word out to them.
You've been innovative even in marketing this service and training your doctors how to market and become successful. What has been the most successful marketing technique that you've used in your office?
We've used a lot of different things. My mother was in the advertising business. She grew up with her father owning the largest advertising agency here in Buffalo, New York, Ellis
Wow.
Advertising. So my mother was in the advertising business since she was 15 years old. She joined our practice when I started and my brother started in practice. She came over from her father's business and just did our marketing for our practice. So
Wow.
we did TV, radio, and print 34 years ago. There was no such thing as the internet. There was no
Correct.
such thing as online marketing. What we found is the biggest thing, honestly, is the infomercial. It's
Yes.
unbelievable. We do a 30-minute infomercial that we record here in Buffalo. They put it on the air in their community, and the patients love it. They learn so much about watching that show, and
Yeah.
then they're pre-sold, and they come in, they just want to book the procedure. But now, of course, everything is online, and you can promote a lot of those commercials and
Yeah.
videos online as well.
I did start with radio, mailers, but when I switched over to TV, I found that with all the other advertising modalities combined, TV pretty much trumps everything. But
It
I'm wondering
does.
now with the digital world, because you're reaching so many people, I'm pretty sure it probably surpasses that. But I still do only TV and I still get a great amount of business from that as
Yeah,
well.
television is fantastic. Nobody stops watching TV. And during COVID,
Uh
that's
huh.
all people did is watch TV for 2 years. They
That's
didn't go
right.
out of their house. And we
Right.
just kept advertising, even though we weren't really seeing patients because the dental offices had to close. But when we started opening back up, we had an influx of patients. So many people had watched our infomercial about the mini implants, and they were just waiting until our office opened back up.
That sounds like a good problem to have. You didn't
Yeah.
have a lull. In fact, you
Yeah.
probably made up for that time that you were closed there.
We really did. It's kind of crazy how busy we got and how many patients came in to have their teeth fixed. And I think also some people were happy to have COVID because they could put a mask over their
That's,
smile. And then when they could finally take the mask off, they goes, "Oh my God, my teeth are terrible. I want to get them fixed."
I just want to ask one more thing. For doctors that are starting out with this procedure, let's just say they've decided to go forward with getting the training and going forward with the procedure. I know you and your dad started with stabilizing lower dentures. Would you advise them to start there and why?
I think the simplest thing is to start doing a lower denture stabilization. It's a simple procedure. There's typically enough bone to put the 4 mini implants between the mental foramen, and you won't get yourself in any trouble. And you get your feet wet with a simple lower denture stabilization. And then after you do a couple of those, you might want to do an upper bicuspid tooth. If you want to replace one tooth, that's a pretty straightforward tooth to do, and then you can expand from there to any other tooth you want to do. But just get some under your belt and you'll be fine. You're no longer referring these patients out to the oral surgeons and the periodontists. You're going to keep that revenue right in your own practice and not just do the implants, but also do the restorative work.
That's
So,
right. And patients only want to come to your office. They don't want to be referred out for all those things.
yeah, they trust you. You're their general dentist. They trust you to know what's good for them.
There's a little bit of a learning curve, but with a procedure as simple and non-invasive as this gives doctors a whole lot of options to do things that maybe they wouldn't have considered doing before, wouldn't you say?
For sure. And I'm glad you mentioned the learning curve because that's where we're going to come in. We're going to help them. You and I are there to hold their hand and help
Absolutely.
them with their first couple of cases. If they have any
Yes.
questions, they can
Uh-huh.
give us a call or email us questions or text
Mhm.
us, and we'll give them advice on how to get past that learning curve. Andrea,
And
you're a wonderful lecturer and you come across so genuine that people
thank you.
just eat it up. And
Right.
I'm excited to have you come lecture with us again very soon.
Oh, I will definitely be lecturing with you a couple times a year. That's
Yes.
definitely on my plan.
Let me tell you, it's our life's work. It's my life's work to help doctors around the country. That's what I've been doing for 20 years, and I love it. And I get
And
text messages and phone calls all day long from dentists everywhere asking a question about this, that, or the other thing. You know what they say, Andrea, and you and I are cut from the same cloth. I know
I
that.
agree.
If you want something done, you find a busy person to do it.
That's right. We actually do get more done. Any parting advice for these new doctors that you would like to impart on them? We've covered a lot. And to me, this doesn't even tip the iceberg of what you have brought to the profession. I believe that you are a pioneer who has led the way, and we are all so fortunate for that.
Well, you're very wonderful, but let me just tell you, I'm incredibly impressed with you, Andrea. You do a great job with everything you do. You're a wonderful dentist because I've seen the work you've done on patients. I see the lab work coming in and going out, and I see the quality of work and the x-rays that you do. So you should be very proud of what you've accomplished in your career as well.
Well, thank you. When I first started, I started with the 3M technique, but when I learned that there was a way to do this procedure to do single teeth and multiple teeth and actually full roundhouses, I needed that structure of a stent or some planning. And that is where Shatkin first really came in and took my practice to the next level, because now I could confidently, with the guided stent, take my patients from being edentulous to having teeth that feel like they are their own natural teeth. And so that is a great
Medical legally, it's a smart idea to utilize a surgical guide stent. It really is. That's the other reason why we want to have that available.
Thank you so much, Todd, for sharing with all of us all of the many advances that you are personally responsible for. I can't really say enough of how many doctors I personally know whose lives you've changed. And because of that, they have gone on to change many lives. So if you look at it that way, your reach is far greater than you could ever imagine.
My father always said, see one, do one, teach one. We're spreading the gospel, and now we've got a whole group of soldiers out there teaching the mini implants as well.
That's great. Well, thank you for joining the podcast, and I'm sure we'll talk very soon.
Thank you so much. It's great to be here with you, and I hope to be a guest of yours again soon.
Absolutely.